Day 3, the last day of the Providence nurses' strike.
We want to work in a respectful environment to both our patients and ourselves.
On Tuesday, more than 3,000 nurses walked off the job at Providence St. Vincent, Willamette Falls, Newburgh, Hood River, Milwaukee, and Medford. They're asking for higher pay, improved staffing conditions, and better health care benefits.
We didn't want to strike to begin with. Our nurses have been at the bargaining table since October.
Now, as the largest nurses' strike in Oregon history draws to a close, nurses like Katie Mosslander are ready to return.
My scrubs are clean and fresh and ready to go, so I'm planning on coming in to do my job.
It's unclear, however, whether Katie and other staff nurses will have a shift to return to, at least for the next 2 days. In preparing for the strike, Providence hired temporary nursing staff for 5 days, their contract minimum, they say, and 2 days longer than the strike.
This is not new information.
Jennifer Gentry is Chief Nursing Officer for Providence Central Division. She says nurses will be notified if they're on shift Friday, and normal operations will resume Sunday at 6 a.m.
We're not going to disrupt that plan mid-course and put patients in jeopardy. So we're committed to the plan we've made for the 5-day replacement period so that it's least disruption for our community and patients as possible.
Striking nurses and the Oregon Nurses Association argue the hospital's short-term contract obligations are not their concern.
Since we have expressed to Providence that our nurses are only on a 3-day strike, if they, at tomorrow morning at 6 a.m. or 7 a.m. when we go in, if they say, no, you cannot come in, then that, under our understanding of the law, is a lockout. We, at that point in time, will file unfair labor practice charges.
But was that part of their strike strategy from the start? Last summer, a different Providence nurses strike lasted 5 days.
No, I mean, we're trying to get a contract here. We're not trying to mess with anybody.
Providence officials are concerned that some staff nurses may disrupt patient entries if they return to hospitals before Sunday.
I think it's important that I call out that nurses are responsible for creating a healing environment, and strikes don't absolve them of that responsibility.
I guess they forgot that we're all professionals and that I've worked here for 16 years without causing a scene. So I don't plan on causing a scene tomorrow. I plan on coming to work.
Nurses tell me if they're turned away from hospitals tomorrow morning, they plan to just keep picketing. Negotiations are set to resume after the strike. Providence officials tell me nothing has been scheduled yet.
Yeah, hoping they come to some sort of agreement soon. Thank you for that report, Kathy.